Hi, I'm Professor Ewen Griffiths. I'm an upper GI and general surgeon at the Harborne Hospital in Birmingham, and my NHS practice is at the Queen Elizabeth Hospital in Birmingham. Yeah, I think it's just because I enjoy the anatomy of the upper GI tract. I like the fact it's fairly complex and challenging. In particular, the esophagus, which runs from the neck to the chest to the abdomen. So it potentially allows me to operate on 3 body cavities, being an upper GI surgeon, and I find that really quite interesting. I think it's successfully treating patients with quite debilitating symptoms, whether it's abdominal pain from gallstone disease, doing a fairly straightforward keyhole cholecystectomy and getting them pain-free, or seeing patients with really quite severe reflux or regurgitation or difficulty swallowing due to big hiatus hernias and successfully performing operations on them. And it's also, in my other field is cancer surgery, surgery is one of the few curative treatments for esophageal cancer. So that's what I find most rewarding. So when patients come and see me, I would review them in the outpatient clinic. I'd take a full history of their symptoms, ask about their past health and previous health issues. Ideally, I would have access to the full range of medical records and results. If they haven't had any up-to-date scans, I'd organise them. Most patients I see may need an endoscopy or quite complex investigations, whether it's CT scan, ultrasound scan, or complicated tests on the esophagus. So I'd arrange them and arrange to review them afterwards. Or if it's fairly straightforward, arrange for them to have an operation under a general anaesthetic on one of my theatre lists.